MN as an organization started during the COVID-19 pandemic. So we came together specifically to solve an issue that we found for the senior living space, in which they all of a sudden had to do hundreds of diagnostic tests every other day. This was something that was new for them, and they certainly weren't enabled with any type of technology or an approach that could allow them to do that and to be able to keep the pandemic at bay. So we came in, we solved for that problem for them. We went outside of traditional healthcare boundaries that existed and allowed them to solve for the needs they had for COVID-19. What we realized almost immediately was how ill-equipped they were in general to deal with infectious disease prevention and maintenance as a whole. It wasn't a COVID-19 issue that we were finding. It was really they weren't armed with basic technology that existed in almost any other vertical to do the job that they needed to do to care for residents. So we started paying attention to other things they needed, right? So we solved the bulk testing needs for diagnostic testing, but then we started to say, well, wait a minute, how are you tracking who's already had it? How are you tracking who's now been exposed? And we started to tech enable those steps as the pandemic stretched on to protect them for COVID-19. And then we started to really learn more and more about this group that we were serving and building technology for. And we started talking to them about the flu, right? And this was something pre-COVID that they were always monitoring in a very similar way. If flu came into these facilities, there was no such thing as just having the flu. It could be something that ended up with residents dying. If it started to spread through a facility, now they had other upper respiratory issues, et cetera. And meanwhile, the very same gaps that they had to prevent COVID-19 existed for all infectious diseases. And they were tracking all of the efforts they put into to prevent illness within their facilities on paper, in different spreadsheets, inside of employee files or resident files. They had really nothing that was bringing together any tools or information for them to actually prevent illness within their facilities.